ma'am. I'm Bianca Rodriguez, your student nurse for today. So today, before starting to our procedure, please state your name and your birthday.
I'm Anderlyn Flores. My birthday is on November 16, 2009.
Okay, ma'am. So today, I'm going to assess your neurologic system, especially your cranial nerves and your reflexes. So first, please occlude your one side of your nose. Do you smell something?
Yes.
Okay. So you're the other one. Okay. For assessing the optic nerve of the patient, we'll be asking the patient to cover her one eye. So please cover your one eye, ma'am. So I'm going to magpapakita ako sa iyo ng number, so you need to identify how many fingers are I'm going to show. So how many?
3,
This.
5,
Your other eye. Cover your other eye. And this?
3, 5, 3, 2, 1.
Okay. So thank you, ma'am. So for assessing for the oculomotor, we'll be using a pen light. So the patient is kailangan niyang sundan yung pen light. So we'll be doing it. So please, sundan niyo po yung pen light. Wala pa po yun. Okay. Sundan niyo po yung pen light. For trigeminal, so we'll be checking the patient's ability to clench her teeth. So please clench your teeth, ma'am. So the patient will be able to clench her teeth. For the facial nerve, so we'll be testing the anterior part of the tongue of the patient. So we'll give him something taste or bitter. So maybe we'll be asking the patient to do some facial expression like smiling, frowning, popping your cheeks, raise your eyebrow, and squint your eyes. Okay, so the next one is to test for the acoustic nerve. So we'll do a Rumberg test. So we'll ask the patient to stand. Please stand, ma'am. So, yes. So, we'll be asking if to stand. I think slightly apart. Okay, so we'll be doing an acoustic nerve test. So we'll be performing a Rumberg test when we'll ask the patient to stand and put her arm side. Then her feet is slightly away from each other. So we'll be checking for the balance and posture of the patient. So we'll be asking the patient to close her eyes. So if we find some swaying, minimal swaying of the patient, the result is negative. So you may sit down, ma'am. So for reverse test, we'll be checking for lateralization and vibration of sound. So bone and air conduction is bone conduction and air conduction. The normal finding is air conduction higher than the bone conduction. So mas maririnig mo yung tunog kesa sa vibration. of the mastoid process. So for the glossopharyngeal nerve, we'll be focusing for the uvula. So we need to put a tongue depressor inside their mouth. Then let's see if the uvula will be moved. So we'll be asking the patient to say ah. So please say ah.
Uh,
Ah.
uh,
Okay. Also check for the gog reflex of the patient and the patient ability to swallow. So, so vagus nerve is also performed when you ask the patient to say ah and the ability to swallow. Vagus nerve is also performed when you ask the patient to say ah and the ability to swallow. For the spinal accessory nerve, ask the patient to shrug the shoulder against resistance. Shrug the shoulders against resistance. So for hypoglossal nerve, we'll be asking the patient to move their tongue side to side. Okay, thank you, ma'am. So we're done with the cranial nerves and continue for the reflexes. So reflexes is like nagpo-focus tayo dun sa part ng spinal cord ni affected. So first, we'll be testing for brachioradialis reflexes. So here. So we're going to improvise since we don't have hammer. Like this. Okay. So please, we're going to like this. We'll be testing for brachioradialis reflex. So please. Yeah. So we'll see if there are some movements. Okay. For the bicep reflex, this sa tricep mag-elicit yung reflex. So please. So this sa tricep mag-elicit. So the next one is the tricep reflex. So we'll be asking the patient to do this. So is dito na. For patellar reflex is hindi siya ginagawa dito. We'll be checking for the patellar reflex. So for the Achilles reflex, here at so dito sa likod ng paa ng patient. So dito siya. The next one is the plantar reflex. So we'll be drawing an inverted J like this. So dapat mag-curl yung toes ng patient. So taas mo. Taas mo. So dapat mag-curl yung toes ng patient when we do the inverted J. Okay. For traumatic reflex, normally sa lalaki siya ginagawa, so hindi na natin siya gagawin. Pero sa inner thigh siya ginagawa. For meningeal irritation is your Brusinki and your Kernig sign. So your Brusinki, you're going to ask your patient to supine position, like hihiga. Pwede po kayo mahiga, ma'am. For Burkinse test, we'll be asking the patient to do a supine position. Then, tataas natin yung sa bandang leeg niya. So yung knee niya is mag-move ng involuntarily. Okay. So for the Cranial test, we'll be asking to flex the knee upward. So, so please straight your legs. Do you feel any pain, ma'am?
No.
Okay. The findings result is negative. So don't forget to